Professor Nasser.
Before I start, actually, last week, my esteemed colleague, Dr. Riba, came to my office trying to bribe me to give her some of my slides so she will know ahead of time what I'm going to talk about. Of course, I didn't give her anything away. So mean. And I promised I'll dedicate a song for her during my presentation. And you will know what is this song at the end of the presentation. So the question here, it's not like I'm telling communication skills should not be taught, or health professionals in general should not have formal training. This is a difference between what I'm trying to say. Having lecture-based, having tutorial-based is not the best venue or the best way to teach communication skills. We have to think of other ways. And I will try to convince you in the next 20 minutes or so why I'm saying this. So the first question I have, I would like to know what the audience views on this. So please just remind you, all of you have the voting system. Just press the red button. So you cancel the old vote. The question one, have you had formal teaching or training in patient health professional communication skills, either as undergraduate or postgraduate level? You can start the clock, so you can count, you can vote now. Just put the letter and then press OK or the blue button. So most of you actually did have, or actually 42, yeah, 77%, right? 78% had formal thing. That's very good. Okay, while only 22% did not have. I don't know how effective is this formal training, but we will. Okay. The next question: do you currently teach or previously taught patient health professional communication skills for undergraduate or postgraduate candidates? Can we start the clock? So you press the red button to get out of the clock, and then you choose your answer, and then put the blue. Okay, so about 45% actually do teach. It's good. We have the right audience for this kind of debate. Next question. If you teach communication skills, we're talking about mainly health professional patient communication skills, not other one. How do you teach it? A lecture or tutorial type classroom activity, simulated patient interview, real patient interview, use of illustrative videos, or others? Can we start the clock, please? So you can choose the letter, and then you press the blue button, please. So the majority use simulated patients, and only about, was still 24% use lecture or tutorial-based, and the rest are less. So you don't use real patient interview for communication skills, which is it's quite pretty actually, because that's what is very strong way of demonstrating, because that's real life communication skills with real patients. Okay, can you go to the presentation, please? So, as you know, the main thing here, we want the patient concern. We always tell physicians, nurses, any health professionals, you have to try to elicit patient concerns. Next. I'm going to actually give you a demonstration first. What happens in the classroom? And maybe some of you have. So I'm going to show you what I think is taught in the classroom. The difference between listening and hearing. So hearing is hearing, listening is listening, okay? So that's what happens actually in the classroom, correct? Second example. Some of you may have attended presentation how you can enhance your empathy. So there are several methods to enhance empathy. Like you have to be exposed to role models, role playing, studying literature, improving narrative skills, and the list is ended. It's just you have to choose whatever you like and do it. So this is another example of what happens actually in real life in terms of teaching communication skills within these kind of settings. Okay, I'm going to show you a couple of studies which shows that how good we are as, this is physicians based, in eliciting patient concerns. This is a study published in 1984. This was done on 74 doctor-patient encounter. It was mainly internal medicine resident in ambulatory care settings in Wayne State University. And the results is only 23% of the visits, the patient provided opportunity to complete her opening statement. In 69%, the physician interrupted the patient's statement and asked direct questions towards specific concerns. And of these 51, only one patient completed operation. So we don't give opportunities for patients actually to complete what they want to say, especially, and we interrupt them. So we are very good into interrupting, and there are other studies which shows that this may curtail the interview towards different direction to what the patient wants. Okay, that's the study anyway. And then about 15 years later, this is a study done to soliciting the patient agenda. Have we improved? It is again done in the North America or US setting. This is 264 constituent encounters. These are a group of 29 board-certified family physicians, but 9 had special training in communication skills, and they had actually a fellowship. So this was a very elaborate, good training. And the result is patient concerns were solicited in 75%, but the opening statement was completed only 28%. So there's still a lot of interruptions and not letting them complete their opening statement. But what happens is that the people who had special training did actually much better than the people who did not have special training. So the lesson from this is that the training actually does work. But the question is, what kind of training? Okay? So that's what the essence of the debate here. In a systematic review, so this was a special review, a systematic review of randomized controlled trials. This is looking at teaching communication skills, patient health professional communication skills. About 15 trials were identified, and the effects are large when teaching intervention was a small group discussion, giving structured feedback. So don't look at the linguistic part of Dr. Ibarra, where she expanded the classroom so much. It's like endless definition. But what we meant by classroom is what you and know, what we know about what happens in real life, what we mean by classroom. So look at, if you give structured feedback, you actually do improve. You have an effect. If you give small group teaching interactive, you do have an effect. Other methods did not have actually any meaningful difference in improving communication skills. So choosing the right way to train people is very important. The second thing is empathy. we all know that you should be compassionate to your patients. And telling really is completely different from changing people's behavior or attitude. And we are actually that, and there is a lot of literature now that medical students, their empathy level actually declines because they are so overwhelmed with other stuff. They decline as they go through medical school. And this study shows longitudinal cohort study where did empathy questionnaire on a cohort of students before they enter the medical school and at the end of each year until they graduated. And they did a matched cohort and unmatched. And what they mean by this, the matched cohort actually they identified their names every year. So they know who they are, they know what specialty they wanted. Of course, it was optional whether you identify your name or identity. The unmatched cohort, the one who did not identify their names, because they want to know the difference here. And the empathy score declined in year 3. And year 3, and this is what is in North America, where actually a lot of the patient encounter happens. A lot of the clinical teaching is happening, where they spend more time in the clinical settings. So there is an irony here that where you need empathy most, empathy declines. And while there was only among this group, 27% had no decline in empathy. So there is a different breed, if you like, who did not actually decline their empathy as they went through medical schools. And as always, but not in this debate, of course, this is just to show you the decline here. As always, women win, but not in this debate. Because females had higher empathy scores compared to males throughout the different stages. And that's why now Kuwait University is preferentially admitting females to the medical school compared to males. So this is proved by literature. And also the thing, there was no difference between, in the matched cohort, they looked at the people's subspecialty. They were people-oriented, which is pediatrics, medicine, psychiatry, family medicine, and technology-oriented, anesthesiology, pathology, who don't like to talk to patients. They just want to do their own stuff. And there was a difference between these two groups, that people who people-oriented actually had a better empathy score compared to technology-oriented people, okay, or physicians. Actually, there's a study done in Kuwait medical students by these group, I think they are medical students and by Dr. Luqman Talib, which again, it shows that the female medical students in Kuwait had higher empathy, and it seems that it actually improved initially fourth year. Fourth year here still they have very little clinical experience. And then when they go to the hospital, again their empathy declines. So almost similar to what the study I showed you before. So empathy here, there's an editorial which is called Cure for the Common Cold. And this was somebody who writes, can this ability be taught? Empathy. The most boring lecture I ever attended was a lecture on compassion. And I'm passionate about the subject. The lecture talked about eye contact, leaning forward, touching the patient. But these are all outward manifestations that can easily be faked. So how can we wrap our mind about this problem? Now remember that exhaustive list I showed you, which was not very useful or nothing. There was something that caught my eye, which is shadowing a patient. Is if you allow students to spend one morning or one afternoon accompanying a patient throughout what they actually happens to them, the outpatient, while they're waiting for the physician to be seen, or while they are doing the test, while they are going through this, can this give them a different perspective on how patients feel and be able to have more share the patient's ideas? So even if throughout some bad lectures, if you like, you can get some bright ideas. So this is actually done, it's not part, there's in the UK, there's something called Doctor Shadow Patient Experience for the National Health Services, a change day, where they asked health professionals to do something for one day to see how patients feel. And this physician, who's a GP, chose to be in a wheelchair for one day. And what struck me, he wrote, what struck me was how the little things we all take for granted became so much more difficult. Things like getting through doors, driving a car. And this experience helped me to see them as people instead of medical problems. And that's what we really want to foster in our medical students, to see patients as people and not as medical problems. So now the choice is yours. If you are in charge of medical curriculum, if you get empathy, do you spend one morning shadowing a real patient and ask the student to write his or her reflections, or would you spend 50 minutes lecture or a classroom interaction with the students to try to emphasize? Now, check, just be sure the questions.
Sure.
And then we'll just,
You're done?
just a question and then the song. Yeah, go just to, so based on what you heard so far, if you plan, just to use your voting system. So if you plan to teach principles of empathy to your student, which method would you use? Lecture or tutorial-based activity, patient shadowing and session for students to reflect on their experience, both or neither, because simply this is almost impossible to teach. So can we start the counting, please? So please press your choice, and then we'll see who's the real winner. Dr. Ibrahim. So it looks like we both won because you think that you need a vote. I was hoping that all of you would say just
B.
B. But actually about 17% also think it's B and forget about lectures and things. Okay. That's not the community.